Oh, hi friends. I was just finishing picking up my part of our medical equipment. My kids and I have been playing that we kind of worked at a hospital. So I had my pretend stethoscope, and I had a syringe that I can get medicine with. I had a white coat that fits my kids, but not really me, and my otoscope. But I'm just gonna go ahead and keep putting all of my stuff away in my medicine box. Do you ever play that you are a doctor or maybe go to the hospital? Right now, I know sometimes it's actually a little bit scary because we're all staying inside and people are kind of nervous that we might get sick with what's called coronavirus. Have you guys heard about that? You might also have heard your parents talking about it as what they call COVID or COVID-19, and for us it means the same thing. The reason that the coronavirus is so tricky right now is because humans have never had to kind of handle that before. And our bodies normally fight off all of those things. But our bodies haven't learned how to fight that off. And our scientists haven't figured out how to make medicine for it. But once our bodies learn to fight it off and our scientists learn to make medicine for it, it's not going to be as big of a deal as it is right now. But right now, to keep ourselves safe, we're staying inside and we're washing our hands and we're wearing masks. My friend Miss Maggie made me a mask. It feels kind of silly to put on, but it goes over my face like this. See, she made it out of some pretty fabric for me with some ties. She's a really good sewer. So it goes over my face to cover my nose and my mouth. Kind of like that. And then I tie it at the back of my head. It kind of feels weird, but it helps keep me safe. And it helps keep everybody else safe around me. And so I wear this when I have to go out to get groceries or maybe to get something else for like one of the kids. But masks can be kind of scary. And you know, I was talking with some other kids the other day, and they have some family and friends that work at hospitals that are having to dress differently than they normally do. We're kind of used to wearing doctors wearing those white coats and maybe even gloves sometimes, but right now our doctors and our nurses and all of the people that work at doctors' offices and in the hospitals look kind of different. And when people look different, it can be kind of scary for us, especially when we don't know why, and especially when their faces are covered. Because you can't see me, and that can be kind of hard. My husband actually works at a doctor's office. He works at one of the hospitals, and he's about to leave for work. But you know what? I bet he has time to actually come in and talk with us a little bit. So let's see if he's available. Hey, Ben, are you here for a minute before you leave?
Oh, yeah.
I was just talking to my friends here.
Oh, hi, friends.
This is my husband, Ben. He's really good at the job that he does. He works at one of the hospitals at Spectrum Health in Grand Rapids.
I work at Butterworth Hospital, and, oh, look, it says here on my jacket, I work in the Neuroscience Critical Care Unit.
Look at that. It says on your jacket exactly where you work.
And who I am.
Benjamin Grant, PAC, and you have a badge too.
I have a badge. Has my face on it.
Oh,
it's a really
that's
old picture,
helpful.
but
That's helpful.
yeah.
And this is how I normally see you go to work.
Yeah.
You're in your outfit. We call them scrubs. That's a funny word.
Yeah, people that work in the hospital, most people, wear different kinds of clothing to go to the hospital. And so you're going to see us in similar clothes, but a lot of times different colors depending on what our job is. I'm a PA. I work with the doctors. It means a physician assistant. It kind of means that I help the doctors see more patients. And I work right beside them treating patients. A lot of times you'll see us wearing, especially in the ICU, coats like this. Black coats. We just kind of look like we're casual, and part of that's because it's easy to clean and it doesn't hang off of us. But I actually have some of my other stuff here.
Yeah,
Can I show you this stuff?
because right now you're having to dress a little bit differently than you normally would at the hospital.
Yes, absolutely, so that we can stay safe.
And keep everybody like you safe and your family members.
So I'm going to take this off, and so this is my jacket.
And it can be cold at the hospital. I don't know about you, but I'm always cold, so
Yeah.
jackets are good.
Sometimes. So when we take the jacket off, most people you see in scrubs are short sleeves, and a lot of times we may or may not have a watch on, and they really recommend that we don't wear that many things because it's easier to stay clean when you don't have them on.
Are you good at washing your hands?
Very good. It's very important in the hospital. They actually have people that train us and watch us to make sure that every time we go into a room, we wash our hands, and every time we come out of a room, we wash our hands. And that's to make sure that we don't bring germs to a patient, and make sure that we don't take germs from one patient to the rest of the hospital or to another patient. It's to keep everyone safe.
You know, I wonder if our friends know how to wash their hands. I have a little song. Would you mind singing it or just kind of washing your hands
wash with
me?
you.
Okay. So when we wash our hands, it's really important right now that we make sure we get all the germs off of our bodies and off of our hands, I mean, because the coronavirus, it can go away off of our bodies when we wash them. So here's a song that I like to sing that helps me know how long to wash my hands. We go tops and bottoms, in between, in between. Don't forget the wrists now, that's where all the germs are. Now we're clean, and we rinse off, now we're clean. Do you sing a song when you wash your hands at the hospital?
I don't sing a song, but I worked in surgery for a while, and they're really, really picky about how you wash your hands. And one of the things that people often miss is actually the back of their thumb. So think about that when you're washing your hands. It's very easy to forget those backs of your thumbs.
Let me think about that. When I was washing, you're right. I probably didn't wash the backs of my thumbs as well. And fingernails too. That can be important to wash. So wash your hands, and that can help protect yourselves and protect everybody else around us.
Absolutely.
What else do you do to stay safe at the hospital right now?
So most of the time, this is what I look like when I'm working. But right now, with the coronavirus, it's caused a lot of people to step up the amount of protection that we use, not just for ourselves, but for the patients. Just like washing our hands, we put on extra things on our body to keep us from passing germs to our patients.
What a good idea.
And keep our patients from passing germs to us that we could then carry outside to someone else.
Can you show us some of that stuff?
Sure.
And I know you don't have all of it because some of it stays at the hospital.
Right. I don't get to bring stuff home. I just have a few things that I typically keep with me. So kind of to start with, this is my white coat. This is something that you're probably used to seeing doctors wear.
Oh, that looks very professional.
We wear them sometimes in the ICU, not all the time, just because we would take them on and off and on and off.
And that also
It also says what I do.
where you work and your name.
And this one says Spectrum Health. This is where I work. So you might see a doctor or someone that's taking care of you wearing a white coat like this. I'll let this make do for my gown, and we can kind of talk about that.
We do need to tell our friends what a gown is, because right now you're not wearing your white coat as much as you're wearing a gown. So
Correct.
What's the difference?
So a white coat is something that I only have a couple of these, right? And if I wore this into every patient's room, I can't wash it in between patients, right?
Right.
And so I could carry germs on my white coat.
That's true.
You know, it's not always as big of an issue when I'm not, getting that close, but in the ICU, we're often very close to patients. And so right now, not many people are wearing their white coats. The white coats, if you do wear them, have to go home and be washed every day, just like your scrubs that you're wearing. So what we do have is we have gowns, and they're often like a really pale yellow color in the hospital. And they're kind of funny because you actually put them on the front side, and they're open in the back, and they get tied together in the back. So it's kind of tricky. And it looks like you're wearing your clothes backwards.
Could I try that with your coat? Because that sounds kind of fun.
Sure.
So I put it on backwards?
So you put your arms through.
Like this?
Like this.
It's going to be kind of big, but I bet your gowns are big.
The gowns are
too.
kind of big too.
Okay, like that.
And so then you can turn around and someone will tie the back up, and see how this keeps your entire front safe.
It does.
And that way it doesn't open up and let germs in.
And is this also something you wash, or is it something you throw away?
So the hospital washes these gowns. They're used one time. They're put in a special trash can when you leave the room. And those get washed in really super hot water with really good detergents every day to make sure they stay safe.
I'm going to take
So
my
can you be
hospital
our
gown
mannequin?
I
Is that
will
okay?
be, yes.
So you're wearing your hospital gown.
Okay.
Okay. So before you go into a room,
This is fun. I get to play dress up and do what you do.
Right. Things that you're going to want to do is, let's see. A lot of times we wear masks, just like you showed your mask. I have a mask, and a really nice lady made this for me because we're using a lot of masks at the hospital right now, and you might have heard there's kind of a shortage in masks and things like that. So people in the community are stepping up and helping out. So I can bring my mask with me, and I can put it on myself.
And so that's one kind of mask that you wear. That one looks kind of like mine. They're both made out of fabric.
Yeah.
But that's not normally the masks
So
that you
these
wear.
are helpful. but these are not as helpful as some other masks because air can get around the sides of them and small particles can get through the cotton.
So that's normally not what you wear, but it is helpful for me when I go grocery shopping.
Yeah,
and
if
things
you're going
like
to be, you know, a distance from someone, you're not going to be up close. This is completely helpful. Okay. But if you get up close to someone, you don't want to catch those germs. So, you know what? I just happen to have, this is what we call an N95. This is probably something you've heard a lot about lately.
Well, I don't know if my friends have, but
Maybe
their
not.
parents maybe have.
Your parents have probably heard a lot about these. These are special masks. They use lots of different kind of filtering. Even part of it's like a magnet in the way that it filters out all the good stuff.
Filtering mean?
Oh, filtering means it lets the air through, but it catches everything else that you can't even see in the air in the mask so that it doesn't get in your body.
Okay.
Okay? These masks are a little bigger and they cover a lot more of your face, so you can be kind of almost scary sometimes to see someone, especially if they're a stranger and then you can't see their face.
Right. My friends and I were talking about that.
Yeah.
How as people we like to see faces and masks cover faces.
Yeah, so you can't see someone's face to see if they're smiling or if they're angry. It's really difficult. But these are very important, not just to keep your nurses and your doctors and your PAs and your respiratory therapists, all these people safe, but to keep you safe.
Can you show me how that works?
Sure. So when we put these on in the hospital, you a lot of times you take them from the outside. You want to make sure that they're clean on the outside, right? And they go on your face. And then you pull the elastic around.
Oh,
to
that
the top.
does look funny.
You pull the other one around. And then these seal down really tight to the face so that all the air goes through the mask and it doesn't leak around the edges.
I see, that looks really tight around there.
Yeah.
So germs aren't going to get through that.
Right.
Oh, it's good to know that you have that to
It's
keep
very
you
helpful.
safe and other people
I'm going to go ahead and take this off.
Okay.
Because it's a little bit stuffy and hot in here. And if I don't have to wear it, I don't want to.
Okay.
Okay?
And I know that normally we wouldn't share masks at the hospital.
Absolutely.
But could I try that one on?
Yeah. You can
Okay.
try this on.
Let's take a look at that. I don't know if you guys can see that. It looks really funny. There's the outside of it. There's the inside of it. So it's kind of like a little bowl. The straps are stretchy. I'm going to try it on. Let's see. So it goes over my mouth
It
like
goes
this.
over your mouth and
Okay.
nose.
My glasses kind of get in the way.
Yeah, they do.
Okay. And around like that.
Around like that. And the other one goes all the way down around your neck.
Like that.
Perfect.
And
So
then I tighten that.
You would tighten that down. And in the hospital, you would put this on before you put your gown on.
Okay.
Okay?
I'll let you guys see that. Look at that. It kind of looks kind of funny for those of you who know what I look like. Because it covers so much of my face. But you're right, it is kind of hot in here.
Right now, we're also covering our hair a lot too. And that's especially for ladies, for females. They want to, or people with long hair. They want to make sure that their hair's not hanging down and gets germs in it. So they're wearing hats too. Would you mind?
No, that's fine.
Okay.
And this is a special kind of hat.
This is a special kind of hat. A lot of times they're just a really pale blue. It's something that is disposable at the hospital. But again, people are not liking the fact that they have to pull those on and off, especially if there are germs around. So a lot of people are wearing these. So first you put a hat on.
Okay. And this is called, it's got
called
a
a
special
scrub
name.
hat.
A scrub hat. And it ties in the back. Okay, so let me see if I can tie this. I don't know if you guys can tie your shoes yet, but it's even trickier backwards.
That's true.
Oh, I'm starting to look like a doctor.
Next,
I'm going to show you the back. Look. Can you guys
that's
see
cool.
that? Okay. Okay, so
Very
now
nice.
what?
So now put your mask on.
Okay. So I do it from the outside. This is a little tricky if you're not used to this. Okay. And I get it there and pull it up
Very
like
good.
that.
Yeah.
Okay. And then the other one up to the neck. Get a nice seal there.
Very
okay.
good. So the other thing you want to do is you want to protect your hands.
Oh, that's
and
where
your
a lot
eyes.
of germs are. Okay.
So you have glasses on, but those glasses are kind of small. So you might need to wear bigger glasses or protective eyewear.
Okay.
Those
So-
go over your glasses.
These are just clear kind of glasses that are going to act like a shield over my eyes. So I put them on like that.
Just like that.
Okay, get my ear there.
That's a lot of stuff.
That is, and my face is almost all covered.
Yeah.
Germs aren't going to get to me this way.
No. So then the next thing you would do is you would wash your hands.
Okay, so we do our hands, making sure to get the top of those thumbs.
A lot of times
in
we'll
between.
use hand sanitizer in
Okay.
between when we're not doing something dirty. Okay. And so you would sanitize your hands. And then the next thing, let's see if I have some here. You're in luck. I actually have some gloves, and
Okay.
they're clean gloves, I promise. So then the next thing you would do is you would put on gloves.
Okay. Would I need to take my rings off if I were at the
A
hospital?
lot of times they recommend we don't wear rings under them just because they can tear the gloves
That makes sense.
or they can get gunk in the rings, those types of things. Some people still wear rings.
So now I have my special gloves on.
So now you have special gloves.
And so I'm not getting germs from the people I work with.
Right.
And I'm not giving them my germs either.
That's right. And you're keeping everyone safe.
Oh, I like that.
Yeah. But it's kind of tricky because I can't really tell what you look like. You have so much stuff on.
I do. It's like I played dress up.
And being in the hospital is already scary.
Yeah.
So have you been in the hospital before or in a new doctor's office? It's kind of a scary place with new people.
It is.
Imagine meeting new people that may be poking you and doing scary things,
And it looks
and
like
you can't
this.
even see them. You don't know who they are. Not only are they a stranger, but you can't even see them.
Yeah.
That's frightening.
But there's a person under
But
here.
there's a person under there. You saw that before she put all of this stuff on. And there, there are a lot of doctors and nurses now who are actually printing pictures of themselves, and they're having someone pin it on their gown right in the front so you can see them. Kind of like a name badge, but a lot bigger. It's a really good idea.
That is a good idea.
Not everyone's doing that yet because it takes a little extra work.
You know what, though? I bet our friends, if they ever needed to see a doctor's face, can ask to see your badge.
Yeah, you could ask to see the badge.
Because everybody has one of those at a hospital.
Everyone.
So I think our friends should see what I look like after I take all of this stuff off.
Absolutely.
Okay, so I'll take my gloves off.
So you would take your gloves off, and then you would wash your hands.
Again, washing
Again.
hands. Okay. Wash my hands, getting those thumbs,
Yeah.
backs, fronts, in between.
Very
okay.
good. And then you would take off your gown.
Okay.
And there will be people just outside the room to help, so you could turn around, they could untie it for you so you're not spreading germs back here.
Okay.
You would turn around, and the gowns kind of come off inside out,
Ah, just like
and
that.
then they go in a special trash can,
And now you can see my clothes.
and now you're back in your scrubs.
Okay.
Just like this.
Just like that. I wish I had some
I
of
can
those
take
cool
off my
things.
white coat.
Okay. Those look comfy.
These are kind of comfy.
Okay, now what do I do?
So now you are going to wash your hands again.
Wash my hands again.
Yeah.
Lots of hand washing.
Lots of hand washing.
Okay.
And then you're going to take off your mask. Now,
Okay.
now that you've had your mask on, if you've been in a room where someone's really sick, then if it's filtering, and we said filtering is what? It's cleaning
Yeah, cleaning out all the
the
yucky
air,
stuff.
right?
Right.
Where do you think all that yucky stuff is trapped?
I bet it's on the outside of this.
That's right. So you don't want to touch the outside of your mask now
Oh, that's smart.
because it has germs on it.
Mm-hmm.
And so there are actually different things people are using. One of them is just like a Tupperware dish. You know, those things that you put leftovers in and you put the lid on and you put them in the refrigerator. They're taking one of those and putting it over their face.
Oh,
And then the elastic straps go on the outside of it.
okay.
And then they put the lid on it. And so then it's safe inside of that plastic box.
You know, I don't have a Tupperware lid, but I do have a little doggy pool from a Barbie playhouse.
Yeah.
Let's see if that might
That
work.
would work.
So we do this. Okay.
Yeah.
Oh, I'm not very good at this yet.
It's tricky. It takes a
Okay.
lot of practice.
And then, where's my other one? Right here?
Uh-oh, that one got
Oh,
caught on your
yeah.
glasses. So stop. You would need some help now.
Oh, okay.
So that's when you have someone there to help you.
Uh-huh.
They would take your glasses for you.
Okay, and then, that came off just like that.
Yeah.
And
you
there's my
didn't-
face.
You didn't have to touch it.
I didn't. So all the germs stayed there. It closed up
Closed up.
for next time.
And you know what would happen next?
What?
What do you think you should do again?
Wash my
We're going to wash our hands again.
Wash, 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 wash. Okay.
Yeah.
Now what? What about
So
my hat?
your hat stays on.
Oh.
Unless it's a disposable hat that needs to be thrown away. You're going to leave it on all day long.
Okay.
Okay. So when I go to the hospital, if I have a long day, which most people that work in the hospitals work for 12 hours at a time, whether it's all day long or all day night. When I get home, I might be carrying germs on my clothes.
Yeah.
And I want to keep my family safe.
I'm
So
glad.
a lot of people in the hospital now are doing kind of weird things. And if you have someone in your family that you know that works in the hospital, they're probably doing the same thing.
I mean, you're already kind of weird, but
Well,
now it's a little weirder.
Absolutely, but life's more fun if you're weird.
It
So
is.
we're stopping outside of our home, whether that's in the garage or by the back door, or some people don't even have that option right in front of their front door. They're taking off their scrubs before they come into the house and putting them in a plastic bag. They go straight in, put them in the washing machine, and then they go and sterilize their hands just with some sanitizer, and then they go get in the shower.
Yeah. Because before, when you would come home, you'd say hi to us in your scrubs, and then you'd go get in the shower.
Right.
But now you're coming through the back door,
Mm-hmm.
and you're doing all of that other stuff before we even see you. So by the time we
Right.
see you, you've already showered,
Yep.
and your clothes are different, and your scrubs are in the washing machine.
Absolutely.
Thank you for helping keep us safe as a family.
You're welcome. Looking at the time, it's about time for me to go to work.
Okay, well, let's see if I can take my scrub hat off, or your scrub hat
Yeah,
off.
I might need
you're
that.
going to need that for work today. Okay.
Well, it was nice meeting you all, friends.
Thanks, Ben.
You're welcome.
Have a good day at work, and I'll see you later.
Thanks.
Bye.
Bye.
Oh, friends, I don't know about you, but that was sure helpful. Because right now there's some scary stuff that we can be kind of nervous about with doctors and the coronavirus. It was good to hear all of the important ways that the hospitals are helping keep us safe and helping keep the people that we love safe, like my husband. I think I'm going to go find my kids and play some more. I'll see you guys later. Bye.